Welcome to our training on preventing back injury. According to a study on the global burden of disease, low back pain causes more global disability than any other condition. In fact, it's one of the most common types of pain reported by patients to healthcare professionals. The good news is that back injuries that cause this and other types of pain are preventable. It can be hard to break habits like poor posture and easy to rush and forget good practices like stretching and lifting techniques. But it's well worth the effort to avoid back injuries. After completing this training, you will be able to recall how the back works and list the most common types of back injuries. You will also be able to recognize risk factors for back injury, recall the common causes of back injuries, identify the best ways to prevent a back injury, and recall the steps you should take if a back injury occurs in the workplace. The back is a central part of the body, connecting many other important parts. Its major functions are to protect the spinal cord nerves and anchor the legs, hips, ribs, arms, and head. When there are back problems, these connected areas can be affected as well. The opposite is also true. Issues with connected parts can stress the back. Select each part of the back to see a brief description. An injury to the back is usually a muscle injury and is very painful. The most common back problems are strain and fatigue, often caused by bad posture. More serious injuries to the back include fractured vertebrae or an injury to the spinal cord nerves. Such injuries are often caused by slips, falls, and impact trauma. Improper lifting can also cause damage, such as pressure on the nerves of the spine or a tear in a disc, leading to disc ruptures, and diseases like arthritis and cancer can also weaken the back. Risk factors are conditions that can increase the chance of an injury. The more risk factors you are exposed to, the greater your chance of developing some type of back injury. For example, as you age, the discs in your back tend to compress, dehydrate, and become less pliable. Other factors that increase your risk of back injury are poor physical fitness, which includes your weight, strength and flexibility, physical stress, and bad posture. As we grow older, the discs in our spines may degenerate due to years of use or misuse. This is commonly known as wear and tear and can cause an individual to live with chronic pain for many years. Degeneration and aging can cause a number of problems, such as bone spurs on the spine, known as osteophytes, loss of bone density, osteoporosis, disc aging, and facet and joint damage resulting in lower back pain. Inappropriate alignment and use of the spine speed up the aging process. As we age, the muscles in our back also lose their strength and ability to function. These weakened core muscles are not helping carry the load, so more stress is applied to the spine and its vertebrae, discs, and stabilizing muscles. The result is pain and an increased risk of injury. The next risk factor for back injury is your physical condition. Both the physical fitness of your muscles and your body weight affect the back. Strong and flexible muscles and joints reduce your risk of injury. If your ligaments and muscles are weak, then discs in your back may be susceptible to injury and possible rupture. Your core muscles provide a great deal of the support for your back. If you have weak core or abdominal muscles, your back may not get the proper support it needs, and your risk of injury may increase. The second aspect of your physical condition that increases your risk for back injury is your weight. That's because excess body weight puts extra strain on your back, and this can cause damage because the back operates on a 10-to-1 ratio. This means that bending over to lift a 5-kilogram object puts 50 kilograms of pressure on your lower back. So, when you add the 48 kilograms of the average human upper torso, lifting a 5-kilogram object puts 530 kilograms of pressure on the lower back. Being just 11 kilograms overweight adds an additional 110 kilograms of pressure to your back every time you bend over, increasing the wear on it and your risk of injury. So, maintaining a healthy weight reduces the pressure on your back, which in turn can reduce your risk of injuring your back. Select factors that increase the likelihood of back injuries. Physical stress is defined as unwanted physical strain or pressure on the body. Stress may keep our muscles in a state of tension or contraction. Chronically tensed or contracted muscles stop circulation of the blood and oxygen, resulting in pain and atrophy in the muscle. When our back muscles are in a state of stress, they are more susceptible to strains, sprains, or spasms. Bad posture can put physical stress on a body. Posture is the balance and alignment of your body. Remember earlier when we said the shape of the spine is very important? Your spine is designed to stay in a natural S or curved shape in order to keep your body weight evenly distributed. If the S curve is out of balance, the vertebrae are pushed out of line, stressing muscles and discs and causing pain. All too often, we hold ourselves in improper postures where the S curve is out of balance. Two common examples are leaning forward when you sit or hunching over while you stand, both of which can cause you to lose support in your back, which may lead to musculoskeletal problems and back pain. Select the person with the best posture. The risk factors we've just examined can all increase your likelihood of suffering a back injury. But there are other more direct causes of back injuries. Identifying and understanding these causes can be your best defense in preventing injury. Most back injuries result from overexertion, improper lifting, or poor environmental conditions. So, let's examine these common causes in more detail. Overexertion happens when you strain your back, such as when you lift something much too heavy, or when you fatigue it, such as when you don't take adequate breaks. Fatigued core and back support muscles can compromise our posture, lifting technique, and make us less able to cope with unexpected job demands. What may overexert the back depends on the risk factors of the individual in question. For example, an athlete may have a higher threshold for overexertion than someone who is out of shape. We tend to ignore the subtle signs our back gives us when we have done too much until we suffer a debilitating injury. These early warning signs of overexertion could be brief spasms or a pain. But if we continue to lift or push or pull, ignoring our physical limitations, there's a very real risk of serious long-term damage. Improper lifting techniques are another major cause of back injuries. If you carry an object improperly, you can subject your back to pressures 2 to 10 times the object's actual weight. Improper lifting techniques include bending over a load and trying to pick the load up with your back muscles. Unnatural positions, such as reaching higher than shoulder height or below the knees, or twisting when lifting, can also strain the lower back or cause you to lose your balance. You'll strain your back even more if you don't hold the object you're lifting close to your center. That's because the applied weight of an object and the exertion required increase as you move the object away from your body. Which of the following is a sign of overexertion? The third common cause of back injuries we're going to look at is environmental conditions. They are physical surroundings and situations. There are several environmental conditions that could lead to a possible back injury if not addressed. The first is your path of travel when lifting. It should be clear of obstructions and hazards. Otherwise, you risk a slip, trip, or fall while carrying, pushing, or pulling an object. Whenever possible, make sure your workplace is organized so you are reaching for objects between your shoulders and knees. To avoid back injuries, it's important to use the proper techniques when lifting, pushing, and pulling. Having and using the proper equipment, such as hand trucks and electronic or powered lifts at work, is another way you can reduce the risk of injury. And there are also personal preventive measures, such as improving your posture, that you can take to keep your back in good shape. Let's take a closer look. We'll start by looking at techniques for safe lifting. Before lifting and carrying any heavy object, you should first assess the situation. What are you lifting? For example, if you are lifting bagged materials, be prepared that their contents may shift and make it difficult for you to maintain your balance. Are you ready to lift? In other words, have you stretched and assessed your body to make sure you don't have strains or fatigue that could worsen? Some good questions to ask yourself would be, how far do I have to carry the object? Is my path clear of clutter, cords, slippery areas, overhangs, stairs, curbs, or uneven surfaces? Am I going to be able to see over the object while carrying it? The next step is to test the weight of the object to see if you are able to lift it correctly. If the object is too heavy, get help or use a mechanical device. If you find that you frequently need help to lift, talk to your supervisor about obtaining mechanical lifting devices, such as a forklift or pallet jack. When you're ready to lift the object, squat in front of it, bending with your knees. Make sure to get a full hand grip on the object and keep your body erect. As you lift, tighten your abdominal muscles to support your back. Lift the object slowly and carefully using your legs and arm muscles. While lifting, keep your head positioned so that you are looking straight ahead. Be sure to keep the object as close to your body as possible. Finally, when turning to place objects, move your feet instead of twisting at your waist. This will prevent you from losing your balance and reduce the strain on the muscles of your back. Let's review those steps to safe lifting. Drag the safe lifting steps into the correct order. When you carry items, be sure to wear appropriate gloves in the right size. For example, gloves with rubber dots on them may improve your ability to grip. Loose or thick gloves may make it harder to grip, forcing you to work harder to maintain your hold. Use handles, grips, and handholds if they are available. If you only need one hand to carry something, alternate between the left and right. If you carry an item over your shoulder, such as a water cooler bottle, consider putting a pad over your shoulder to cushion it from the pressure and weight of the item. In addition to safe lifting techniques, having and using the proper equipment while you work will also reduce your risk of back injuries. Proper equipment often involves ergonomics. Ergonomics is the science of adjusting the job to accommodate the worker. Your workplace should be designed to help you prevent back injuries. For instance, when standing for long periods, you are at a greater risk to strain your back, so use a low footstool and rest one leg on it, alternating regularly. This will help relieve the pressure put on your back while standing. At work, always wear comfortable, supportive shoes that are properly cushioned, and make sure they have slip-resistant heels and soles. When heavy or bulky objects need to be lifted, use mechanical aids such as hand trucks, material carts, forklifts, conveyors, or pneumatic lifts. And, if a mechanical aid is not available, get help from a coworker. You are the third and most important preventive measure in reducing your risk of a back injury. That's because you have great control over many of the risk factors that could lead to back injuries. First, maintaining good posture when sitting or standing on the job can have a great effect on the maintenance of your back. Sit up straight at tables and desks so that you do not slump or slouch. When standing, don't hunch over. Remember the natural S-curve that keeps your body weight evenly distributed. Make sure you take care of yourself by following a regular exercise program that emphasizes cardiovascular exercise, strength training, and stretching. Sleep on a firm mattress on your side with knees slightly bent and a pillow between your knees, or, if you sleep on your back, keep a pillow under your knees. Avoid sleeping on your stomach with your head resting on a stack of pillows. You can also look after your back by keeping your stress levels low. This will prevent your muscles from tensing up. Finally, stay aware of back safety issues. Remember that most back injuries are cumulative, so even if you just have minor back pain every now and then from lifting, years of improper lifting techniques, poor strength, flexibility, and posture can build up and cause major back problems. Before you work and throughout your day, make time to stretch to reduce muscle fatigue and keep muscles flexible and strong. Doing so will reduce the likelihood of injuries and improve your body's performance. Exercises that stretch and strengthen the muscles of your spine can help prevent back problems. If your back and abdominal muscles are strong, you can maintain good posture and keep your spine in its correct, most natural position. Do stretches and exercises to relieve stress and alleviate fatigue, even if you've worked a long day. Imagine you need to lift a box. After you assess the situation and test the weight, you determine that the box is too heavy for you to comfortably lift. What are two options you can use to prevent back injury? In most cases, back pain isn't caused by a serious injury or illness. We simply overexert ourselves by improperly lifting or suffer from fatigued muscles when we don't rest and stretch. Most minor strains will go away in time if you stay limber and active. There are some exceptions to this general rule about staying active. If you are injured, such as in a fall or traffic accident, or if your back pain includes numbness or tingling anywhere on your body, you should see a medical professional. Your doctor will assess your condition and recommend next steps such as physical therapy, time away from work, and so on. It is possible that you may injure your back, even if you take all the necessary precautions and are in good health. Report the injury to your supervisor immediately. Follow workplace policies regarding medical care and treatment. Finally, follow healthcare provider medical advice about medications, treatment, and physical activities or limitations. You are at work when you bend down to pick something up. You feel a sudden sharp pain in your back, and the pain continues throughout the day. What should you do? Once you have reported the injury to your supervisor, what should you do? You should now be able to recall how the back works, list the most common types of back injuries, recognize risk factors for back injury, recall the common causes of back injuries, identify the best ways to prevent a back injury, and recall the steps you should take if a back injury occurs in the workplace.